Do you know the difference between home care and home health care? I'm Jonathan Marsh, the owner of Home Helpers Home Care of Bradenton. In this video, we will explore these two types of care services, their distinct features, and the typical pay sources associated with each. Are you ready to learn more? Let's go. So home care and home health care are terms that are oftentimes used interchangeably, which sometimes makes things a little confusing. And it's not to necessarily say that somehow these terms are being used incorrectly, but there certainly is a bit of an undocumented industry standard on how the terms are most frequently used. So when we speak in terms of this industry standard, it makes understanding the differences a whole lot easier. So when we talk about home care and home health, both are valuable options for individuals who require assistance or medical support in the comfort of their own homes. However, they refer to different types of services and may have different pay sources. So home care on one hand primarily focuses on providing non-medical assistance and support to individuals who need help with daily activities and maintaining their independence. This type of care is typically provided by caregivers or home health aides, and oftentimes we refer to this as non-skilled care. So home care services can include services like companionship, meal preparation, medication reminders, light housekeeping, transportation, running errands, or assistance with personal care tasks such as bathing or getting dressed or using the toilet or transfers or ambulation, and much, much more. So home care aims to ensure that individuals can remain in their own homes both comfortably and safely. So when it comes to paying for home care, these are some of the typical pay sources. So you've got private pay, and so many people pay for home care services out of their own pockets or savings. Then you've also got long-term care insurance. So some individuals may have traditional long-term care insurance policies that can cover home care services. And certainly the coverage and the terms are going to vary depending on the policy. Then you've also got Medicaid. So in certain cases, Medicaid, a government health care program, may cover home care services for eligible individuals with limited financial resources, and that eligibility criteria is going to vary by state. Then you also have veterans benefits. So veterans and sometimes their spouses may be eligible for benefits through the U.S. Department of Veterans Affairs. And the VA, as we call it, can help cover the cost of those home care services. Now let's move on to home health care, which differs from home care because skilled care, or in other words, medical care, is being provided. And one thing that I think is important to note, we oftentimes receive calls from individuals that say, my health insurance covers home health. Like I'm looking at my policy and I see right here it says it covers home health. So when you see that, the insurance policy is referring to skilled care or medical care, not non-medical care. So in other words, health insurance generally does not cover the services of a caregiver or a home health aide in the home. Now, home health services involve skilled care provided by licensed healthcare professionals such as nurses or physical therapists, occupational therapists, or speech therapists, and some others. So now let's go over some of the common pay sources for home health services. So first, Medicare. So Medicare is a federal health insurance program for older adults and certain individuals with disabilities. It may cover home health services for qualified beneficiaries. The services must be deemed medically necessary and provided by a Medicare certified home health agency. You've also got private health insurance. So some private health insurance plans may cover home health services, but the coverage and the eligibility criteria are going to vary. So it's important to check with the insurance provider for details. You've also got Medicaid. So similar to home care, Medicaid may also cover home health services for eligible individuals with limited financial resources. So that coverage criteria is going to vary by state. Also, pay sources out of pocket. So some individuals may choose to pay for home health services themselves if they do not qualify for other pay sources or their insurance does not provide coverage. So in summary, home care and home health are distinct types of care services catering to different needs. So home care on one hand focuses on non-medical assistance, while home health care provides skilled medical care, right? So remember, the pay sources we discussed may vary depending on individual circumstances and the specific policies of insurance providers and government programs. Thank you so much for watching our video on the differences between home care and home health care. I hope that this information has been helpful and that you find it useful for either your current needs or your future needs. For more information and for answers to many questions about home care, feel free to go to our website and download our complimentary Florida Home Care Guide that I created to help navigate the home care landscape in the state of Florida. Depending on the platform that you're watching this video on, you may see the link in the comments or in the description of the video. If not, put homehelpershomecare.com/Bradenton in your browser and then navigate to resources, free guides, and then look for the current version of our Florida Home Care Guide in the menu. If you have any questions, please feel free to reach out to us. Take care, and until next time, we'll see you soon.